Hello, my name is Ivy. I'm a fourth-year social work student at Toronto Metropolitan University. I'm currently completing my placement with the Organization for a Safer Space. Today, I will be talking about factitious disorder. In this video, we'll first look at what factitious disorder is. We'll then look at the risk factors, symptoms, effects, treatment, and lastly, we'll look at some coping strategies. Factitious disorder is a mental health condition in which a person feigns or exaggerates symptoms of a physical or psychological condition. These actions are done for psychological gains, such as obtaining attention and care, as well as coping with stress. People with this disorder undergo several unneeded medical examinations and cause challenges for healthcare workers when attempting to make a diagnosis. There are two types of factitious disorders, including factitious disorder imposed on self, which involves falsely presenting oneself as ill by feigning symptoms or making oneself sick. Factitious disorder imposed on another involves feigning a child, pet, or loved one as sick with fabricated symptoms. Risk factors. It is believed that factitious disorder develops in response to life events, including a major childhood illness. A study found that 60% of patients with factitious disorder had a history of a major childhood illness. Traumatic experiences during childhood, including emotional or physical abuse. A 2014 study revealed that a majority of participants with factitious disorder reported childhood abuse. Symptoms. The symptoms of factitious disorder involve reporting physical or mental health symptoms that do not exist, exaggerating minor health symptoms, deliberately causing health symptoms such as purposely injuring oneself or taking poison, falsifying medical tests or records, such as adding blood to your urine sample to get an abnormal result. Effects. People with factitious disorder have a higher risk of developing health problems from taking numerous medical tests and treatments. They also have a higher risk of substance abuse, self-injury, undergoing risky procedures, costing the healthcare system a significant amount of money, and attempting suicide. Treatment. A person with factitious disorder will typically deny the syndrome and treatment for it. Therefore, receiving treatment will depend on someone else, encouraging the patient to seek help. The main treatment for this disorder is psychotherapy. A common type of psychotherapy is cognitive behavioral therapy. This type of treatment can help a patient identify and change unhelpful thoughts, feelings, and behaviors. Family therapy can also be beneficial, as family members can learn about the disorder, including coping strategies. Family members can also learn to not reinforce unhelpful behaviors of the person with factitious disorder. By not giving the patient the attention they are seeking, the patient may have a decreased need to feign sickness. A medical professional may also prescribe medication for co-occurring conditions such as anxiety or depression. Coping strategies. A person with factitious disorder can cope using the following methods. Seek medical care from one trusted provider. Be cognizant about the risks of self-inflicted injuries or risky treatments, including permanent injury or death. Seek support from a family or friend. To help a loved one cope with factitious disorder, a person can avoid confronting them about their condition. Instead, be understanding and compassionate. Offer support through kind gestures or engage in activities together. Encourage them to talk with a therapist about their distress. If you have any of the symptoms described in this video it is important to seek help. Feel free to check out the organization For a Safer Space at forasaferspace.org, where you can have access to accessible, affordable, and affirming mental health care with licensed mental health professionals. Thank you for watching and have a great day.